Okay, now tetracycline cases are not the only difficult cases. There are other types of very difficult cases. One, as I mentioned, is age-related. Typically, older individuals are said to have bleaching-resistant cases. And deep bleaching rejuvenates the teeth and makes it so that we're still able to get a magnificent result. Now take a look at this 79-year-old patient. Look at the before and after. Again, dentists never thought that it was possible to bleach in a situation like that. Now take a look. This patient was 78 years old. An absolutely amazing result. Another difficult case would be a congenitally dark case or what we call fluorosis with brown spots. Now take a look here. Now this is your typical brown spot type of a case, and just look at the huge difference from before bleaching to after. And by comparison, here's another typical case. Look at the beautiful result. Another question you have is, what will your teeth look like afterwards? Will they be natural looking? The answer is yes, they will. Now you may have seen people with ultra white teeth that looked opaque and very false looking. Well, that's because they were false. They were probably either denture teeth or porcelain crowns or caps or porcelain veneers. And these were probably restorations that were made too white, too opaque, and therefore fake looking. Natural teeth cannot look anything but natural. So no matter how white your teeth get, as long as they're natural teeth, all they look is beautifully white, not fake in the least. Now the picture you're looking at right now is a picture that's very important to me because this happens to be a before and after photograph of my own teeth. My teeth were deep bleached 6 years ago, actually over 6 years ago. Now, take a look at the porcelain shade tab in the top picture, and you see where it says C4 on that. And then on the bottom picture, you'll see where it says C4 again. So I would like to show you what my teeth look like today. So what I'm going to do is I'm going to ask the cameraman to zoom in, and I have that same C4 tab here so that 6.5 years later, you can see what my teeth, bleached with deep bleaching, look like today. Are we ready? Okay. Pretty amazing, isn't it? And that's after lots and lots of red wine, coffee, tea, you name it. I love to eat. So, and there's no doubt about that. So anyway, here take a look at photographs. Now, the first one that you're seeing on the left was me in 1992. Look at those dark teeth. I'll tell you, even when I was in grade school, kids used to tease me about my dark teeth. I had congenitally dark teeth. And I'm not proud to say that I gave that to my son. I hate this genetic stuff. You have no control over it. But of course, I've been able to bleach my son's teeth also. But there you see me then in 2003, which was at least a year or two after I had deep bleached my teeth. Quite a difference, isn't it? Before bleaching my teeth, I really felt funny about smiling wide for cameras, for photographs. Well, as you can see on these photographs now, I don't have to worry any longer. So here is another typical case. Just absolutely beautiful result. So as I mentioned, it's important that you understand that if you have any dental work on your front teeth, after bleaching, not just deep bleaching, but any bleaching, be aware that if you've had a big result, that the synthetic restorations, the fillings, any porcelain work will not whiten. So you will need to redo that. And if you have a significant amount of work that's been done on your front teeth, you might decide not to bleach. If you've only had a little bit, it's not a big deal. You just have it redone after the bleaching. Now take a look at this case. You'll notice that on one of the patient's upper left front teeth, which would be on your right-hand side, she had a porcelain crown. And you can see on the after visit, when she was done, that the porcelain crown was much, much darker. And of course, we redid that afterwards and, to the point where it matches perfectly. And this patient is thrilled. And it wasn't a big deal to just replace one crown. And I'm sure another question that you have is, Will you have to give up your staining foods to maintain the color whiteness? The answer is no. You don't have to change your diet. Deep bleaching is so effective that with simple, periodic, at-home maintenance, it is entirely permanent. You can continue drinking your red wine, your coffee, your tea, whatever. You don't have to change anything. And let's take a look at another case, before and after. Very, very typical. Another question that you might have, another concern you might have is whether or not the bleaching trays, the deep bleaching trays, will be comfortable to sleep with. Many people have a concern that they might be uncomfortable preventing them from sleeping, or that they might be swallowing lots and lots of the bleaching gel. No, it's not a problem with deep bleaching. The trays are extremely thin and form-fitting. You can barely feel that they're in your mouth. In fact, most people wake up in the morning forgetting that they're still in the mouth. That's how comfortable they are. By sealing the bleach in and sealing the saliva out, which is what deep bleaching trays do, this allows a full night worth of oxygen to penetrate deeper and deeper and deeper into the tooth, thereby giving you the huge color change that we see with deep bleaching. The other thing is that by wearing the trays at night while you sleep, there's no interruption of your busy day whatsoever. They're so comfortable, it does not disrupt your sleep. You don't have to schedule any particular time to wear the trays. So let's take a look. So now, what you are seeing here is the deep bleaching tray in a patient's mouth. You can see how comfortable that is. It fits absolutely beautifully. And if you look at the red arrows, it points to the edges that seal against the tooth. This keeps your saliva from getting under the trays, and it keeps the bleach in. And with the products that I've developed, with the specific physical properties of viscosity and the appropriate amount of insolubility, we have an enormous result. So now let's talk about the steps of deep bleaching. First thing you're going to do is have an examination with your dentist. And then your dental office staff is going to take some molds, or we call them impressions, of your teeth. It's similar to the molds that we would be taken at an orthodontist's office, except they're more precise. Then the very exacting deep bleaching trays that we've discussed are then fabricated just for your teeth. On your first visit with the trays in the dental office, what will happen is your dentist will apply bleaching gel, a specific type of bleaching gel, into the tray that will be applied to your teeth there in the office. Now, don't expect to see any whiteness from this. This step is a conditioning step. What it does is it helps rejuvenate your teeth so that the bleaching you do at home is even more effective. So don't expect to see any change as far as color from that. Then what's going to happen is your dentist is going to give you an at-home kit that you'll take with you. You'll have your trays, your deep bleaching trays, you'll have bleaching gel, and you'll have desensitizer that you will apply yourself at home every day. Now, when you come back to the dental office after 14 nights, you're going to already be amazed at how white your teeth have gotten. And in fact, you may ask your dentist, wow, my teeth are so white now, they're going to get even whiter? And your dentist will smile and say, you ain't seen nothing yet. Because on that final visit, we're going to get the icing on the cake, that final explosion of beautiful color. Now, when you're done with your final visit, then you will go into a maintenance phase. And periodically, you will wear your deep bleaching trays just one night at a time at home. And you're going to see how very, very simple this is. And your dentist will custom tailor your maintenance program just specifically for you. And as long as you follow this very, very simple program, your teeth will remain the same beautiful color for your entire life. And here we see another case done by Dr. Seth Gibri in Cumming, Georgia. Absolutely amazing result. Now, typically people with red hair and freckles have a much more difficult time bleaching their teeth. They tend to have more sensitivity, and their teeth are more resistant to whitening. But just look at the result that he was able to get. Well, you're probably wondering about cost. Is deep bleaching more expensive than other techniques? Absolutely it is. It's not in the same ballpark with other techniques as far as effectiveness. It's the most effective technique ever developed. It's permanent as long as you follow the simple at-home maintenance. You can still continue having your red wine, your coffee, your tea, etc. There's low to no sensitivity. These are things that you can't say about other techniques. It's worth the extra cost. So if you are looking for white teeth, this is the avenue that you need to investigate. And here's another amazing case. Look at how light this patient's teeth were before she even bleached. And look how much whiter deep bleaching was able to get her. Most dentists won't even attempt bleaching teeth that are already very white like this. Now here's another amazing life-changing case. This one by Dr. Yvonne Wong. And this is a tetracycline case again. Absolutely amazing results. And the point is, deep bleaching is not just for tetracycline cases, but if it's this effective on tetracycline, just imagine how effective it will be on your case.